Hey guys, Alexandra here with MDPen. Thank you so much for tuning in for today's video. We are talking about putting your best face forward as you go back to school, whether you be a teacher, a student, or even a parent. So everyone wants to look their best as we go back to school. And as a med spa, if you are one, you want to choose probably about 4 different treatments or things to discount on your menu. Of course, I would also offer a great deal on your skincare. So let's talk about that. If you are mostly a med spa that specializes in injectables, it's going to be really important, of course, to have injectables on your menu as discounted. And pretty much everyone, whether it's Galderma or Allergan or MERS, they all have coupons and things like that going on right now. So there will be things available. And then also having some type of in-office discount is also going to encourage people to come to your practice. Of course, if you are an adult and you are going to get injectable treatments, there's ones that will kick in faster than others, depending on the neuromodulator of your choice. So if it's very last minute, and you want to look good, your provider can always recommend an injectable that might kick in faster than another one will. But most are, in full effect within a week. So next, of course, you have last minute treatments that are going to make your skin look really good. So things like any type of device facial, hydrodermabrasion, we have our favorites. We like some better than others, but maybe you have your favorite or your med spa has one that you offer. So definitely offer a package deal of those. A lot of times these devices can be expensive too, and you are paying them off, but these are great treatments that exfoliate, extract, and infuse serums, and you do look good when you leave. Now, with MDPen MicroNeedling, we have Nano Needling, which is done with our refined needle cartridge. And with this, you're going to have instant results. So instant plumping, tightening. It's going to draw up hydration to the skin. You're going to look really good immediately after having this treatment done. So this is another treatment I definitely recommend for back to school is going to be Refine or Nano Needling. And this you can do in a series. Definitely have people pay up front for a series if you can. As a patient, it's going to be easier for you if you pay up front for your series. And as you return for your next 2 appointments, a month later and 2 months later, all you have to do is walk in the door and walk out. You don't have to stop at the desk. You don't have to pay anything. Maybe you want to tip cash to your provider. That's always really nice. Especially if it is an esthetician, because sometimes that bit of gratuity can definitely be helpful. So, but paying up front is just easier for everyone. You can offer a discount with it, get a great deal. So definitely keep that in mind when you're prepaying. If someone prepays for regular microneedling and they don't want to do the treatment right away and, go back to school with a red face or whatever, have them pay up front and then they can come in and they've already prepaid and they can schedule the series at that time. Now, also with skincare, you can do a significant discount. So 10 to 20% off of skincare. At MDPen, we love to bundle our kits. And what you can do is bundle a really nice kit or purchase a really nice kit, perhaps at 20% off. And this is an awesome deal. Right now, my favorite kits for back to school and summer are definitely going to be our Summer Sun Kit, which is going to have our broad spectrum SPF 30. It's got your antioxidant vitamin C and E serum and our human derived growth factor gel, which I'll get back to. But the Summer Sun Kit's going to have these 3. It's also going to have our SPF lip balm and this awesome bag, cute cosmetic bag. I see some questions rolling in, so I do want to answer them. What are the best treatments for acne scars and dark spots? Yes, I would love to answer that. Before I forget, because I did forget on Thursday, and I apologize, guys. Here's that shopping code if you do want to save 10% at the MDPen store. Just go to mdpen.co and you can go shopping. The code's going to be good for about 48 hours. So anyway, back to Q&A. What treatment is best for acne dark spots? So it depends how much downtime you want. Microneedling can, of course, help break up pigment. It is going to be great for post-inflammatory hyperpigmentation. And in cases of PIH, which is often the case with acne, people will think that their PIH are scars, and they're actually not. So post-inflammatory hyperpigmentation is different from an actual scar. However, it can really bother people. And I love the men's aftershave kit. I know you might not be a man, but we did call it the Aftershave Kit. However, this kit is great for acne prone skin, great for oily skin, and people that are being treated for hyperpigmentation or PIH with microneedling. It's going to have your HA copper mist. You can use every 2 to 3 hours post-treatment and twice a day moving forward. It's going to have our Tighten and Lift Serum. Now, this serum has lactic acid, green tea in it. It's going to help lighten and brighten that PIH and also just be a great, excellent moisturizer for acne prone skin. So copper mist, tighten and lift, and then again, your broad spectrum SPF 30. Also, it comes in this awesome bag, cosmetic bag, with large zippers, big pockets there. Here's the link for this particular kit, guys, if you want to check that out. What products can help minimize acne breakouts? So this is a very loaded question, and it does depend on your type of acne. If you're having severe acne occurring often, not just like monthly breakouts, maybe one breakout a week, but just every day you're waking up with new breakouts, I do suggest seeing a dermatologist because you may require topical prescriptions, maybe even they may elect for antibiotics in your instance. So visit a plastic or dermatologist if you are consistently breaking out. If it's something your skincare professional, esthetician, whoever can help you with, then that's great. They can recommend everything from vitamin A derivatives like MDPen's Radiant Retinol Balancing Complex, or even our Tighten and Lift Serum, like I said, is a great moisturizer for acne-prone skin, as well as our Pure HA. But everything from, lactic, glycolic, salicylic, there's tons of things you can do if you do have acne. One of my first suggestions is just getting your cleanser in check. And if you're overdoing it with cleanser or using a lot of exfoliants, try MDPen's Hydrating Cleanser. You won't regret it. This is a very affordable cleanser right there on our website. And again, you can save 10% if you want to buy it right now with that shopping code. This is really going to help balance the skin. It's going to help with inflammation. It's going to help with your acne, and also help fade any PIH that's there as well. A mask question. I love masks. That's what I was actually going to get back to. What mask can I leave on to help brighten my skin? So at MDPen, we have our Human Derived Growth Factor gel, which can be worn as a mask, and it is in that Summer Sun kit that I mentioned earlier. It comes in 2 sizes. It comes in a 1 ounce bottle, and it comes in a 3.4 ounce bottle. Now, this is going to be your mask product, whether you're using it as at-home use as a client or patient, or if you're using it in clinic, this is a great treatment to use as a mask on your patients. So this is something you want to leave on for about 20 minutes. You can use it under most LED lights. Just check on the particular light. But it's an awesome treatment. It's going to brighten the skin. It's going to help your skin barrier, help with skin healing, anything like that. And again, Human Derived Growth Factor gel. And we do use this gel after microneedling. It can be used also as part of the post-care. This is a great question. How many times a day can you use the HA Copper Mist? So the day of microneedling, you're going to have that tight, dry feeling with the skin, and you can definitely use it every 2 to 3 hours as needed, especially that first day. Besides that, most people use it twice a day. If you're an athlete in particular, you may want to carry it to the gym. So maybe you're using it 3 times a day, or if you work out outside or run or hike, anything like that, you'll want to use it then too. So I would say anywhere from 1 to 3 times a day, unless it's the day of microneedling treatment, then you may be using it every 2 to 3 hours. What treatments can I bundle for back to school promotions? Yeah, so hopefully I'm answering that in this video, Brian. Thanks for that question. Basically, like I said, I would bundle based on your particular office or spa, what's popular there. So you may often need, an injectable service. If you're a big office on body treatments, then you may want to bundle something like that. Also, if you treat a lot of hair restoration, you may want to put that on your menu. Also, chemical peels. We are moving into what us SDs call peel season. So you may want to bundle the chemical peels on the menu. So let's say you have injectables, microneedling, peels, and then facial. So I would have a facial geared towards teenagers or acne prone skin. And then I would also have a facial that's going to make people look amazing, like that hydrodermabrasion or the nano needling. And you can combine those if you do want to use the Refine MDPen needling treatment during a facial. I call it the Refine facial. Really nice treatment there. So do keep that in mind. I hope this has been helpful for you guys. Again, just to review the skincare, I talked about our Summer Sun Kit, which you can find on the website. For retail people, it's already discounted by 20%. So it's more discounted than the code I'm giving you. And that's what I recommend too, for those of you that are providers that want to purchase the kit. Go ahead and charge the kit at 20% off. This is a really nice gift for your patients, for your clients. And that Summer Sun Kit is going to have the broad spectrum SPF, the growth factor gel, which you can also use as a mask or sleep with a light layer of it on in the evening. And the Summer Sun Kit is also going to, of course, come with vitamin C and E brightening serum. This has licorice and green tea in it, so it is very lightening and brightening. It's a 21% vitamin C. Lots of great ingredients in here, guys. And the Summer Sun Kit's also going to have your SPF lip protection, and it's going to come with the cute white cosmetic bag. The men's aftershave kit is a very nice lightweight kit for summer. It's not just for men. It's not just for after shaving. It's also a great post-procedure kit for microneedling, and it's also just a great kit for oily skin, combination skin, acne prone skin. And it has this awesome bag. Look how big that pocket is. You can tell I've been using mine. And the front pocket there, MDPen. And this kit's going to have your HA Copper Mist, your Tightness and Lip Serum, and your broad spectrum SPF 30 or sun protection. So mist, serum, sunscreen in that order. Awesome kit there, guys. This one's already discounted again for retail at 20% on our website. So it's going to be more than the code that I'm giving you. But if you want to shop for things individually, like the cleanser I mentioned, then obviously you can use the code there. So thank you, guys. I see one last question. Is there a minimum age for microneedling? So this is completely at your discretion as a provider. If you're asking as a patient, this is up to the parent. I mean, if someone's under 18, they need, hopefully the child is willing and hopefully the parent is willing. I personally wouldn't needle younger than 16. Often I think 18 would be, the normal lowest age range, but I have had people ask about 16. So just something to think about, but it's going to be up to the parent, and it's also going to be your call as a provider. The only case where a 16-year-old might want it or need it, let's say they were on Accutane at an early age, like 13 or 14, and they were already finished with their Accutane and they were at least a year out, then that 16-year-old has, probably some scarring. And again, they've finished their Accutane over a year ago. They're no longer breaking out. So that would be someone, but typically when you have someone who's like 16 to 19 wanting microneedling, it's not for fine lines and wrinkles. It's for scarring, but my suggestion would be that they're finished breaking out, which in many instances they're not. So microneedling is not going to be the go-to, but in a situation like that where the acne is resolved and you're not constantly chasing things, then that can be a rare instance where someone as young as like 16 could probably have it done. But always check with the parents, always get the parental consent. Here's that link for the aftershave kit. Again, oily skin kit, post-procedure kit / men's aftershave kit. Do check that out, guys. Thank you so much for tuning in. Happy back to school, everyone. In Florida, a lot of the kids are going back tomorrow, Wednesday. So if you're in Florida, I hope you have a great day back at school. And I will see you guys soon. Bye.